Okay.
So I think out there in the world, no one can. Common sense says more nurses mean safer patients, and it's hard to prove otherwise, right? Mm-hmm. But moving on to another fear that a lot of nurses have. Mm-hmm. What happens if we have to hire 1,000 more nurses? Mm-hmm. What happens to the nursing assistants? What happens to the IV team? What happens to the rapid response team? What happens to the infusion nurses like you? What happens to all of the extra? Because yes, nursing is important, and yes, nursing spends the most one-on-one time with patients, but it's a team. It's not just nurses.
Right.
It's far from just nurses.
Right.
So I'm worried about my coworkers that don't have an RN at the end of their name.
And the question addresses that they can't eliminate those positions because we understand that those folks are very important. And I'm sorry I didn't have it to bring to you, but I will make sure that you will get a copy. There was I have a beautiful graph that was actually posted by the American Hospital Association, their data.
Yes.
And this 86% number keeps coming up a lot. But the increased use of unlicensed personnel in California went up 86% after the establishment of the nurse-to-patient ratio.
So are you telling me that if this passes, that I am not going to be solely responsible for every aspect of my patient's care?
You still are a registered nurse, and you are absolutely responsible for everything that you do. But I'm telling you that the bill addresses the fact that they can't eliminate those unlicensed nursing position or nurse assistant positions and ancillary positions to enact this bill.
So, comment section below, let me know, what are you still concerned about after hearing their side? If there's no, if you're done having the argument, you've decided, great. Let me know why you've decided, all right? And if you still have questions, like I said, down below, I'll contact them every Friday up until November 6th. The Nursing News, I will give you guys updates. Thank you guys so much. Again, shout out to MNA for coming out. Thank you. ANA, I really want to hear from you, so please and thank you. Catch you guys later. Don't forget to like and subscribe, and most important, especially for this, comments down below. Deuces.